This guidance document should be used alongside guidance from provincial and territorial health authorities, ministries of education, and Indigenous community governance structures. School reopening plans developed in your area take into account local epidemiology. Public health and educational authorities will closely monitor the situation and adapt public health measures as needed. Remember that each parent or guardian is making back-to-school plans to best suit the unique needs of their family. There is no one-size-fits-all solution. I urge Canadians to support your community of parents, students, teachers, and administrators as schools work to reopen this academic year. Just as we have been at every step along the way, we're all in this next step together. By working together, not only can we help students of all ages thrive in what will certainly be an unconventional school year, but we will also be able to protect those members of our community most at risk of serious illness. Thank you.
Bonjour. À l'approche du mois de septembre, la réouverture des écoles inquiète pas mal de monde. Aujourd'hui, nous aimerions vous parler plus précisément des recommandations de l'Agence de la santé publique du Canada pour les écoles de la maternelle à la 12e année. Commençons, comme d'habitude, par les derniers chiffres. On a signalé 118 561 cas de COVID-19 au Canada, dont 8 966 décès. Les personnes infectées, 87 sont rétablies. À ce jour, les laboratoires de partout au pays ont analysé les tests de dépistage de la COVID-19 de plus de 4 319 000 personnes. Au cours de la dernière semaine, en moyenne, 48 360 personnes ont passé un test de dépistage chaque jour, dont 1% ont reçu un résultat positif. Enfin, il y a en moyenne près de 400 nouveaux cas signalés chaque jour pour l'ensemble du pays. Tout au long de la pandémie, les Canadiens ont fait de nombreux sacrifices pour assurer le bien-être de leurs familles. Les parents, les gardiens, les élèves, les enseignants avaient tous hâte de connaître les plans de retour en classe pour cette année. Maintenant que les provinces et les territoires ont dévoilé leurs plans de réouverture des écoles, on sait que les familles réfléchissent sérieusement à ce qui convient le mieux à leur situation. Nous comprenons que cela puisse être angoissant compte tenu de nombreux facteurs à considérer. Maintenant que l'activité relative à la COVID-19 est sous contrôle, grâce aux mesures que nous avons prises pour y parvenir, nous devons établir un équilibre rigoureux pour que le taux d'infection demeure faible, tout en réduisant au minimum les conséquences non voulues sur la santé et sur le plan social. Pour trouver un juste équilibre en vue de la réouverture des écoles, nous devons prendre en considération deux faits connus. D'abord, nous savons que l'apprentissage en classe et la socialisation sont très importants pour la réussite scolaire à long terme des enfants. Puis, nous savons que les enfants présentent en général des symptômes légers quand ils sont infectés par le nouveau coronavirus, même si quelques-uns ont eu des problèmes de santé graves. Ce que nous ne savons pas encore très bien, c'est dans quelle mesure les enfants peuvent transmettre l'infection à d'autres. À ce jour, il semble que les enfants de moins de 10 ans soient moins susceptibles de transmettre le virus que les enfants plus vieux et les adultes. Nous devons toutefois surveiller de près les données probantes qui évoluent à ce sujet. Pour aider les directeurs d'école de la maternelle à la 12e année et les autorités de santé publique locales à reprendre le programme pédagogique en classe en toute sécurité durant la pandémie de COVID-19, l'Agence de la santé publique du Canada a rédigé un document d'orientation en collaboration avec des experts, des intervenants dans le domaine de la santé publique au pays. Nous recommandons une approche à plusieurs niveaux comportant de nombreuses mesures d'atténuation visant à réduire le risque de propagation de la COVID-19, notamment la diminution du nombre d'interactions avec les autres et l'augmentation de la sécurité des interactions. Et afin d'appuyer la prise de décision locale, nous recommandons des stratégies pour appliquer la distanciation physique dans les classes pour assurer le lavage des mains et l'hygiène respiratoire et pour maintenir des bulles sociales. Parce que ce ne sera pas toujours possible de pratiquer la distanciation physique dans les écoles, il est important d'agir à de multiples niveaux pour réduire le risque de propagation de la COVID-19. On pourrait, par exemple, offrir des solutions de rechange à l'apprentissage en personne, ainsi qu'ajouter des couches de protection comme le port de masques non médicaux par le personnel et les élèves. Ce document d'orientation devrait être utilisé parallèlement aux recommandations des autorités de santé publique, provinciales et territoriales, des ministères de l'Éducation et des structures de gouvernance des communautés autochtones. Les plans de réouverture des écoles prévus dans votre région tiennent compte de l'épidémiologie locale. Les autorités de santé publique et les autorités scolaires suivront de près la situation et adopteront les mesures sanitaires au besoin. N'oubliez pas que les parents ou les gardiens prévoient le retour en classe selon les besoins particuliers de leur famille. Il n'y a pas de solution universelle. Nous encourageons vivement les Canadiens à soutenir leur communauté des parents, d'élèves, d'enseignants et des directeurs alors que les écoles se préparent à la rentrée scolaire. Comme nous l'avons toujours fait jusqu'à maintenant, c'est ensemble que nous franchirons la prochaine étape. Ainsi, non seulement nous aiderons les élèves de tous âges à réussir une année scolaire sûrement non conventionnelle, mais nous aiderons aussi les membres de notre collectivité les plus à risque d'être gravement malades. Merci.
We will now open the floor and the telephone line to question. For those who are asking questions in the room, we ask that you make your way to the over the freestanding mic. Today we'll start in the room. Just a reminder that vous pouvez poser vos questions dans l'une des deux langues officielles. We also ask that you limit yourself to one question and one follow-up. Le Devoir.
Oui, bonjour, Hélène Buzetti du Devoir. Dr. Njoo, c'est pas très clair pour moi. Est-ce que vous recommandez le port du masque dans les écoles? Est-ce que vous en faites une recommandation officielle?
Oui, avant de répondre précisément aux questions, c'est important de toujours souligner le point que les lignes directrices, notre document d'orientation, c'est toujours important d'être utilisé parallèlement aux lignes directrices et aussi les recommandations des autorités des provinces et territoires. C'est toujours pour être quelque chose supplémentaire, complémentaire, mais pas pour remplacer ce qui se passe aux provinces et territoires. Le deuxième point aussi, je peux faire, c'est que c'est très important aussi qu'il faut être conscient, c'est quoi les circonstances, le contexte à l'échelle locale et en particulier l'épidémiologie locale. Parce qu'il faut être flexible parce que si l'épidémiologie, il y a beaucoup de circulation du virus, c'est complètement une autre situation comparée à peut-être une situation où il n'y a pas beaucoup de cas dans une communauté. Donc, pour nous autres, en fin de compte, ce qu'on dit dans notre ligne directrice, c'est oui. Avec l'évidence et les données probantes, on dit que sûrement en prenant en considération aussi l'épidémiologie locale, avec l'évidence que les enfants de moins de 10 ans peut-être ne transmettent pas facilement les virus, mais les enfants de plus de 10 ans peut-être transmettent comme les adultes, que oui. En général, on recommande que le port de masque, c'est une autre couche, une autre mesure supplémentaire pour prévenir la propagation du virus. Mais ce n'est pas seulement le seul composant, parce qu'on dit qu'il y a toutes sortes d'autres aspects de composants dans un plan. Par exemple, peut-être des barrières physiques, des groupes, peut-être vraiment dans des petites bulles sociales aussi, peut-être dans des couloirs, l'utilisation d'avoir des sens de direction unique. Donc, ce n'est pas seulement une question des masques, mais en total, avec tous les autres aspects, oui, on recommande le port de masque.
We do recommend wearing the mask as part of all the other
pour les enfants
aspects
plus de 10 ans.
Donc, c'est une recommandation, moins de 10 ans, peut-être pas, mais plus de 10 ans, ça serait une bonne idée de l'imposer dans les écoles.
Mais c'est dépensé avec les facteurs, le contexte et surtout l'épidémiologie à l'échelle locale. Parce que tu peux imaginer dans une région, une communauté, s'il n'y a pas vraiment beaucoup de cas, peut-être qu'on peut être plus flexible, peut-être on encourage, et peut-être que ce n'est pas nécessaire d'être une mesure comme obligatoire, mais dans une autre communauté, avec peut-être plus de circulation, plus de cas, dans cette région, c'est peut-être plus important de mettre aussi en vigueur peut-être plus obligatoire, on peut dire, le port de masque.
Thank you, Doctor. Next question, CTV.
Ian Wood, CTV News. In British Columbia, the number of active cases in the last month has more than doubled. And British Columbia has been lauded as having handled the crisis quite well. But things are now relaxing there. People are gathering in larger groups. Does this concern you? And are you confident that the measures governments have taken in provinces across this country to allow larger groups to gather are in the best interest of public health?
So, as everyone knows, I work very closely with all the chief medical officers of health in Canada, including, of course, Dr. Henry in British Columbia. And we know, and we knew that when you reopen social and economic spaces, we will expect cases. We will expect an increase in cases. The key public health strategy is to keep that low and manageable, and the ability to detect, test, isolate cases, quarantine the contacts. So the speed of which you can then find the contacts and quarantine them is the cornerstone of public health measures as we combat the pandemic. So that's the concept across the country, is to keep the activity low and manageable based on your local context. And so outbreaks are being detected and being managed. So we're watching very carefully, of course, on cases where you can't link them. You know, there's a potential for community spread where the chains of transmission are unclear. Across the country, there are different kinds of outbreaks going on, and those are being tracked. Good news is that long-term care facility outbreaks are very low. They are still there, but keeping that very important vulnerable population protected is completely top priority, and other vulnerable settings and congregate settings, including workplaces. So paying a lot of attention to that. What is becoming quite obvious across the country, though, is that with the increase in or the loosening up of restrictions, is a younger population of adults under the age of 40, but that 20 to 29-year-old age group is the number of cases are increasing in that age group. And that's where all the messaging and the sort of flexibly changing policies at the local level is being done right now to try and keep that number reduced. And so it is something that, again, I ask all Canadians, including young Canadians, that this is really important that you follow public health measures. In British Columbia, I think Dr. Henry has very well articulated some of the activities is private sort of parties. And I think in Kelowna, for example, people got a little too enthusiastic. That cannot happen. Right now, the good thing is a number of cases have come down a bit this week compared to the preceding two. Maybe people were quite enthusiastic after Canada Day, let's just say, and kept going on with their sort of that mentality. If we want schools to reopen safely and people going back to increase sort of attendance at universities, we have to right now keep the transmission down, because that's the sure way that you can enable educational institutions to reopen in as safe a manner as possible. So based on everything that I've seen, all medical officers said we're keeping a close eye on everything. Right now it's manageable. We can detect our cases, but this virus, as I've said, is in our backyards, so we can't let our guard down.
Thank you, Doctor. Follow up?
And this can be for both of you. Granted, what we've seen over the summer in the loosening of restrictions and allowing people to get back to some sense of normalcy, what concerns you? What have you seen, aside from, the obvious of people gathering in larger groups? What have you seen in terms of human actions that you think is a cause for concern or alarm as we move forward?
Maybe I'll start first this time. I think Dr. Tam and I I've said this previously, and I think I was the one who a few weeks ago first noted or made the point that what is concerning, I think, for me, from what I've seen, is what's happening among the young folks, the young adults, less than 39. And as we've seen the data come in, what is concerning is that the young folks are becoming an increasingly large proportion of the cases. And what I see is that it's three factors in play. As I've mentioned before. First of all, I think after the winter, everyone I think was been a bit tired of being sort of confined indoors, and so the fatigue factor I think certainly is in play for the population in general, but also especially for the young folks wanting to get out, meet their friends, and socialize. So that's number one. The second factor, I think, is the invincibility factor. I think young folks, by and large, think that they can, quote, get away with anything, that the consequences aren't really that serious for them. And I think, unfortunately, it's a bit of a double-edged sword. The data so far does indicate that the young folks, by and large, if they do get infected, they don't suffer as serious consequences medically compared to other age groups. And so therefore, they might think it's fine for them. But as we all know, they're part of our society, and they actually obviously go to the workplace, and they have maybe older parents and grandparents, and that I think is the risk, is that if they unknowingly transmit it, because many of them may also be asymptomatic, that would also then increase the risk of a transmission to more vulnerable groups of individuals. So that's, I think, the second issue. And then the third one, as you mentioned, is that with the opening up of society, it's always a tricky balance in terms of what is the right sort of level or pace of opening up bars, restaurants, different sectors versus keeping an eye on sort of the number of cases and keeping it in check. And I think a part of it, I think, for maybe the young folks, but maybe everyone in general, is that by opening up society and opening up the bars and restaurants, people think, things are kind of back to normal, or sort of the new normal. And so they may not necessarily go to a bar or restaurant, but they think, if the bars and restaurants are open, then why not can I have a party with 20 or 30 or 50 of my closest friends? And so all those factors are in play, and I think, as Dr. Tam and I've mentioned, is that we recognize in terms of getting the messages out there, keeping Canadians, as say, foot on the gas in terms of maintaining public health measures, things that protect themselves and others. We need to maybe look at different approaches, sort of like segmented market approaches. How do we maybe reach young folks using different platforms and approaches compared to other age groups? So that, from my personal perspective, is what I see as the major sort of challenge ahead.
No, I think going along with the evidence and the epidemiology, I think absolutely what Dr. Njoo has said, we continuously have to do more for vulnerable populations. Every one of those long-term care facilities, seniors homes, have to have all the measures and supports in place to prevent, primarily, the top thing is to prevent introduction and make sure that even one case is rapidly detected and the testing is conducted rapidly to contain the spread. So that still concerns me, because we need everybody to do that well. and we know that the underlying factors have been there for a long time. So it's not, overnight that certain things can be turned around, but we need to keep at it. And also other vulnerable populations. Well, you actually mentioned, I think you asked the questions about temporary foreign workers who are in certain work environments where we need to continuously work towards supporting their living conditions, so to support them so that they don't have to go to work if they're sick, not to move between workplaces if they're serving essential services to vulnerable populations, and continuous support for those who are more disadvantaged and marginalized as well. I think we talked a little bit about the fact that, fatigue is definitely an issue, but I think continuing to leverage on strengths and innovation of where Canada has been so far. We've done very well, and we need to just sort of keep at it. We are planning, of course, hoping for the best is one thing, but planning for a larger resurgence, planning for the influenza season coming up, I think is something that we've all come together as provinces and territories with us to plan ahead. So the fall period is I think a period of challenge, but there's lots we can do to reduce those risks. I think making sure that people get their information from credible sources continues to be a challenge. So as I said in a couple of my previous presses that, it's very easy for misinformation and to sort of propagate in a social media world, and that everyone needs to learn how to appropriately identify credible information, but also not disseminate ones that are not aligned with the knowledge as we know it. And so another ongoing challenge for all of us is that we're still in the middle of a pandemic learning about the virus. And so we will learn more, and there may be changes in how public health will provide its advice. And so I think just to expect that we will flexibly incorporate more knowledge, and our advice might change. So thank you for the question.
Thank you, doctors. Prochaine question, la presse canadienne.
L'inaudible, la presse canadienne. J'aimerais revenir sur la question des directives que vous allez donner cet après-midi. On n'a pas le document. Pouvez-vous nous dire de façon précise qu'est-ce qu'il y a dans ces directives-là? Bon, vous dites port de masque, des sens uniques dans les écoles. Pouvez-vous nous donner comme quelques éléments précis de ces directives-là?
Merci pour la question. Oui, en attente, je pense que c'est peut-être même maintenant que c'est publié, c'est en ligne, peut-être pas encore. Mais il y a beaucoup des bonnes composantes dans des directives. J'ai une ébauche ici. Certainement, le port de masque, c'est un élément. Mais il y a aussi beaucoup des autres éléments aussi. Je ne sais pas comment... Ce que je peux dire, c'est, comme j'ai déjà constaté, que les lignes directrices que nous avons élaborées de l'Agence de santé publique, c'est toujours quelque chose qui doit être utilisé parallèlement avec aussi...
J'ai juste besoin de choses un peu précises. Là. Dans ces lignes directrices-là, qu'est-ce que vous avez de précis comme conseil à donner aux écoles?
Il y a beaucoup de détails. On parle de toutes sortes des options parce que, comme on dit, on a dit que c'est une question aussi pour peut-être limiter, comme c'est pratique, le nombre d'interactions entre les élèves et aussi les enseignants. Et aussi, s'il y a des interactions, qu'est-ce qu'on peut faire pour aussi avoir des interactions plus comme des sécuritaires. Donc, les options comme peut-être garder un groupe des étudiants dans une bulle, peut-être aussi avoir des sens uniques, des directions dans des couloirs, dans les écoles. Peut-être qu'on peut utiliser même les barrières physiques pour garder comme ici des distances aussi, peut-être éviter propagation du virus. C'est toutes les choses un peu comme dit, limiter les interactions et aussi avec les interactions, comme on dit, c'est sûrement une autre couche ou une autre couche de protection, le port de masque. Et
and mask wearing is another layer of protection, as we've said
moins
many
de 10
times.
ans, aussi plus de 10 ans
It
en
is
général.
Merci. Et puis mon autre question, donc ça c'est pour les écoles primaires, secondaires. Est-ce que vous avez fait des réflexions pour les cégeps, les universités qui, elles, ont décidé presque toutes de tout faire à distance? Est-ce que le même genre de directive pourrait s'appliquer? Parce que là aussi, l'enseignement, la socialisation, les jeunes adultes, ils sont assez, leur santé mentale est assez précaire en ce moment. Est-ce que vous avez réfléchi à ça aussi?
Oui, nous avons déjà, je pense, élaboré aussi des lignes directrices pour les universités. On sait que c'est aussi comme les adultes, il y a aussi des aspects un peu uniques comme peut-être les logements, comme à l'université, mais des mêmes principes de santé publique pour limiter le nombre d'interactions, mais aussi le type des interactions. Ça s'applique aussi aux étudiants, aussi au cégep et aussi à l'université.
Types of interactions
Tam, if
that
I
can
can
take
hear you
place
on the
in
importance of
universities
socialization, like
and
the mental health of
CEGEPs.
young adults now. Should they be in the parents' basement learning from afar? It's this September.
Yeah, so it's something that public health is very sort of engaged in because, as we said, people have spent many months now sort of social distancing and definitely physical distancing, but I do mean social distancing in that sense. And yes, young people for their mental and physical health, we need to get them back to education as safely as possible. And so, I think one thing that I want to stress, though, is that an element of anxiety and stress is actually expected. We've just been through we're going through an unprecedented pandemic. So some of that can be managed through different tools and even online resources, sort of telehealth. We've sort of increased that amount of telehealth and other support. And so I think, on the one hand, we actually think youth and young adults are quite resilient, and many of them have managed to cope very well. What one is most concerned about are people in more disadvantaged situations. If there are issues where there is family violence, you've seen some of the data showing that there are in fact more cases, more impact on social, economically disadvantaged neighborhoods. Some youth actually have mental health challenges already or learning difficulties. And so it is with these youth and young adults in mind that I think public health certainly want to do everything it can to enable them to go back safely to their workplaces or their universities. With the guidance, I think that Dr. Njoo mentioned, which is already published, universities have to come up with plans to their local public health departments and provincial public health and ministries of education with how they would open up their educational spaces in as safe a manner as possible. But I do believe that just as schools, youth and young adults, this is the time to want to socialize and interact, but they can learn to do it safely as well, following the guidance of limiting your social circles. If you're going to, restaurants or pubs, follow the rules really, because that's what's setting off some of the outbreaks. barbecues, the virus is in the backyard, think twice and maintain social distancing, hand hygiene, etc. You can do it, and I think your innovation, your strength on how do you manage through this pandemic would be, we would love to hear from everyone. Some of the online stuff that youth have done have been incredible. So the innovation of how you have, some of the games, singing, all sorts of things online, they've invented those. I think they can invent how you innovate in actual physical interactions as well in a safe way.
Et c'est Dr. Njoo, justement pour ajouter aussi des choses pratiques dans les lignes directrices. Si on veut aussi limiter peut-être le nombre d'interactions, c'est vraiment pour les écoles considérées comme des rassemblements de toute l'école, des assemblées, peut-être même des activités sportives, des équipes, qu'est-ce qu'il faut faire. C'est une décision vraiment à l'échelle locale pour les écoles, mais c'est tous les facteurs à considérer. Si on voit peut-être vraiment... donc aussi, selon l'épidémiologie locale, diminuer les risques
and this
de la
should be looked at
propagation.
in the context of local epidemiology.
Thank you, doctors. We will now turn to the phone operator.
Thank you, merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. We have a first question from Mia Robson from the Canadian Press. Please go ahead.
Yes, good afternoon. I'm wondering, in terms of the kids and your comments that at the moment the evidence suggests that kids under 10 are not spreading the virus as much, what evidence we are using to base that on? I've seen a lot of people wondering how comprehensive that evidence can be, given that kids have not been exposed or had a lot of chances to spread this virus in the last 6 months.
Yes, so that's a very important point in that, when the pandemic first started, we didn't know too much about the virus. Schools closed, as much of the community spaces were also closed. So the chances of gathering information was limited. Certainly in household transmission studies at the beginning, it suggested that it was more the adults bringing in the virus and transmitting it rather than the kids spreading it to the adults. Now, there's more information, international context, for example, studies from South Korea, which suggests that, children under the age of 10 do spread. There's no zero transmission risk situation. All age groups can spread the virus, but it appears that children under the age of 10 spread the virus less efficiently than those older than the age of 10 and adults. Those over the age of 10, those studies suggest that they can transmit as well as an adult. So that's some of the evidence that we have taken into account in the current, I always consider them as interim guidance. There are more studies about viral load, how much virus is in the back of someone's nose and nasal pharynx, what we call. That is still under interpretation, but it certainly is as a signal to us that we need to watch what happens when children begin to interact more. And I think it's difficult in the global literature. Of course, we are seeing outbreaks that can happen at schools, but also countries where schools have opened and very successfully. There are cases, but they're manageable. I think in the literature, you tend to also see what went wrong. We also need to document what successfully has gone right as well. So I think all I can say is that every medical officer of health, together with the education department, school boards, I'm sure are thinking through this in an extremely methodical way. And we will learn more as we go along. The numbers of cases so far in Canada, you probably can access our website and look at the number of cases, etc. And they have been, under 19 represent a very small proportion of our cases. and only 1% of the hospitalizations and 1% of ICU admissions, and really no deaths. There was one that was maybe not related to COVID-19 itself, but in someone who was identified to have COVID-19 who passed away. So we know that under those sort of circumstances, people can cautiously, methodically, safely open schools, but we have to monitor what actually happens when we do.
Thank you, Dr.
Thank you for that. We also understand that the Canadian Football League has submitted their health and safety protocols to Health Canada. They're hoping that they might get approval to have some sort of season this fall. Just wondering if the assessment, you've made the assessment on that, and when they might expect, and when Canadians might expect a response on whether it would be approved.
It's Dr. Njoo. Thank you very much for the question. Yes, we have had, or we still are having ongoing discussions with the Canadian Football League, again in the area of professional sports. What I can say is that what has been submitted to us, I think, is encouraging in that they're going, I think, with the similar kind of model that we had for the NHL in terms of, quote, a hub city and using sort of a tight quarantine type bubble. Obviously, there's still details to be worked out, and my understanding is that they've also had discussions, and we've had discussions as well with Manitoba health officials. From, I think, the Manitoba health perspective, I think they're comfortable with what I think has been put forward so far, but like I say, there's still some details and some other aspects we need to discuss. But in principle, I would say that so far, I think it's the same as we had for the NHL, that if there are players coming from, let's say, outside the country, certainly from a federal perspective, it's all about crossing the border, doing your 14-day quarantine sort of in a safe manner. And then after that, the actual sort of how the season might unfold in a very tightly controlled circumstance with regular testing, not really interaction with the general public, and also, as they say, no fans in the stands. And I think it's something we can work with. Thank you.
Thank you, Doctor. Is there any other questions on the phone?
There are no further questions on the telephone lines.
Given that there's no other questions on the phone, if we have a couple more minutes, if you want to do another round of questions in the room. Yes? No? OK. Thank you. C'est ce qui m'a fait la conférence de presse pour aujourd'hui.